Hi everyone! I'm finally back! I think I start every video with that phrase, but this time I'm actually finally back because it's been so long since my last video. Didn't I film it like end of May? I think so. I'm so sorry if you missed me and if you wanted to see a video from me and I didn't deliver. I was actually due to film end of August because I had my last hematology appointment and I wanted to make like an update video, and I did, but it was just bad quality. Like the lighting was bad, I was kind of weird there, and I actually just had a very tough like last couple of months, which is why I didn't really have energy or mental capacity to film and edit a video. But right now I'm all good, and yeah, this video is going to be updates on what's going on with my health, my last hematology appointment updates, and sort of just general life stuff. So yeah, if you're interested in that, stay and I'll talk about that. So I'll start with my last hematology appointment. It was on August 27th, I believe, and my test results came out pretty well. I'm really stable. I'm like, my platelet count is basically the same as it's been a year ago. So I'm sitting around like 770, I think, or 750. But you know, the fluctuations are normal, and I've never been over 800, which is great and means that I'm stable. At least I've been stable throughout the last year. So I went to my hematologist and we talked for a little bit, and the biggest update that he gave me was that he really wants me to do another biopsy, um, which I'm really not looking forward to that, because if you know what a bone marrow biopsy is, you would understand. But it's basically, it is a very, I won't say it's very invasive because it's not like a full-blown surgery, but it is one of the more invasive types of biopsy, and it's really painful, and it's just weird, and it makes my skin crawl when I remember the feeling of them just sucking out the marrow from your bone. It's just, ugh, overall not a good experience. Mine was pretty good last time, as good as it gets, I guess. But yeah, after I did my first one, my doctor told me that I should do a second one in like a year and a half, 2 years. But this time he told me that no, we're better off doing it next time we see each other, which is going to be December. Which is, yes, another update because I've been so stable. We came to the decision that I should start coming every 4 months instead of every 3 months, which is convenient for me because I moved back in with my dad. He lives in Moscow and my doctor is in St. Petersburg, so I would have to like go in between the cities. I always have the option to just start going to a different hematologist somewhere here, but I really don't want to. I really enjoy working with my current doctor. I really trust him. He knows my case through and through, and yeah, he's just an amazing doctor. So yeah, I don't want to start looking for another one here in Moscow when I can just go to St. Petersburg every 4 months and visit him. So yeah, doing another biopsy this December, and they want to look at my bone marrow and see if it changed, if it has more scarring, because right now I'm sitting at the unclassified diagnosis, which is myeloproliferative neoplasm unclassified, because they can't put me they can give me an ET diagnosis, which is essential thrombocythemia, and they can't put me and they can't give me a PMF diagnosis, which is primary myelofibrosis, because I don't qualify for either of those. I'm sort of somewhere in the middle, and I really don't want to be primary myelofibrosis, because that's just like a later stage of the same illness. So you usually start with ET, and then you have like 20 years, then it progresses to myelofibrosis, and then you have another like 15-20 years before it progresses further into like a dangerous zone. But sometimes people start with myelofibrosis, which is why it's called a primary myelofibrosis. And I really don't want to think that I am PMF patient, because that would just mean I have less time and I would have to start treatment sooner, which is going to be interferon treatment, which I, once again, am not looking forward to it. My doctor also mentioned that I might be a candidate for a transplant, which I felt really scared about, and I don't really understand why he mentioned that, because you're only a candidate for a transplant. Like, they only propose doing a transplant when it's like the only option you have left, when it's either that or you die. And I don't feel like I'm there yet. I feel great. My tests are stable. I'm not going up or down significantly. So I'm not sure why he would bring it up. Maybe just to let me know what I guess to expect. But I knew that would be an option someday, maybe, if I progress super far into my cancer and I need a transplant, then yeah, I would do it. But I don't have any close relatives. Like, my parents are too old to give me a transplant, especially if I'm not getting a transplant anytime soon. By the time I would need it, they would definitely be too old. They're in their early 50s now. And let's say I need a transplant in like 10 years, they're going to be in their 60s, which is too old, I think, to give a transplant. And I don't have any brothers or sisters, only half brothers and half sisters. And I also have cousins, but they are also like not even full cousins. I'm not going to go like into my family history, but basically I don't have any close matches, and that is more dangerous when you have to take a transplant from someone completely alien to your body. That is less of a chance of survival. So I am trying not to think about that too much. I'm trying to focus on other stuff, especially because there's nothing yet to be scared of. But I know I'm going to be a mess in December, because I'm going to go to my doctor and we're going to do a biopsy, and then I'll have to wait for the results. And yeah, I am just trying to live my best life before all of that starts. I'm not taking any drugs right now. I do take aspirin very, very rarely, even though my doctor wants me to do it every like 2 to 3 days. I am not doing that because last time I was just struggling so much with my stomach, because aspirin is really not good for your stomach. And I also can't like completely stop aspirin because the mutation I have is calreticulin type 1, which is like, if I was type 2, I wouldn't have to take aspirin, but because I'm type 1, my doctor really advises me to, because otherwise I might develop like blood clots, and yeah, we don't want that. I don't want to have a blood clot at 26. So yeah, I don't have any other issues with my health, so that's pretty much it. And I'll probably have way more updates and way more like video and way more like content for videos in December when I'm actually gonna go there and do all the procedures. I really want to film like inside there and maybe even film during the biopsy because you're like conscious for all of it. But we'll see how my doctor feels about that. Um, so the other life updates is that yes, I moved back in with my dad. I live at our house in Moscow now. It's not in Moscow, but it's like on the outskirts. I am also, I have a week off at my job because I just really needed it and I felt like I was burning out. I felt this burnout coming closer and closer, and I was just like, I need to take a week off. And they approved it, which I'm really grateful for because we are at like a high season right now. Um, so yeah, that's why I had the time and the energy and the sort of, you know, mental space for even filming right now because I was just so busy over the past 1.5 months that there was just no way I was going to film anything or edit or post. So, yeah, those are the life updates. I feel pretty good. I am a little bit scared for the future, but aren't we all? And yeah, I'm glad to film. I'm glad to be posting again. I have no idea what to make videos about because my health is pretty stable, so I don't have a lot of content, like cancer related content. But yeah, maybe you have some questions for me. I would be glad to answer them in the comments or in the next video. I'm not gonna promise anything this time, but I'll try my best. Basically, I'll try my best. And I will see you in my next video.